Professor Chen Hailin, an expert in treating cancer, is a world-class problem. When it comes to cancer, the first thing that comes to mind is death. Cancer is known as a world-class medical problem because of its drug resistance, easy metastasis, and easy recurrence. Throughout the ages, medical scientists have never stopped researching cancer, but they have never been successful. It is not uncommon for people who study cancer to die from cancer. Western medicine is the mainstream of anti-cancer, but Chinese medicine handed down from the Chinese ancestors should not be underestimated. Therefore, there are many Chinese medicine practitioners who do not care about fame and wealth, and treat low-key people in a low-key manner. And Chinese medicine Professor Chen Hailin is one of them. In recent years, the morbidity and mortality of tumors are on the rise worldwide, and the mortality of malignant tumors has become the first cause of death for residents worldwide. Cancer is a disease that is difficult to treat at the current medical level. The reason is that the cancer does not have any symptoms in the early stages, and most patients are found at an advanced stage. Once many patients suffer from tumors, they feel that, and quote, the sky is falling, and quote, and quote, life is hopeless, and quote. The appearance of Chen Hailin brought hope to the majority of cancer patients. In more than 10 years of medical career, Professor Chen Hailin has always adhered to the road of fighting cancer with traditional Chinese medicine. For thousands of years, Chinese medicine has been closely related to the reproduction of the Chinese nation. It is not only an outstanding advantage of the Chinese nation, but also a treasure of world medical culture. In order to promote the development of traditional Chinese medicine, it demonstrates the dual strength of Chinese culture and technology, and also enhances people and APO's recognition of excellent traditional culture. Feel. And quote, Chinese medicine is the quintessence of the country and the treasure of the Chinese nation. It is a glorious mission and a great responsibility to develop Chinese medicine. It has a good reputation in the eyes of patients. It is the belief in life that it has cured patients all over the country and defeated various cancers. The support and progress of Chen Hailin all the time, no matter how the stages and occasions of life change, this belief is always the same. Over the past 30 years, Chen Hailin has treated thousands of cancer patients, many of whom are poor and cannot see a doctor. Nevertheless, Chen Hailin did not give up on them. Sometimes he preferred to treat poor patients at his own expense. Patient, Qin Jinshuan, male, 52 years old, from Nanshuang Village, Luqing District, Chengzhi City, Shaanxi Province, was diagnosed with bladder cancer by 4 hospitals, with an area of 23 mm x 24 mm, and returned to zero after taking traditional Chinese medicine soup for 30 days, and underwent cystoscopy on December 3, 2000. All were normal. Bladder cancer is also a very serious disease among cancers. In addition, the patient was physically weak. After several chemotherapy treatments, the patient was mentally sluggish and physically weak. However, after taking the traditional Chinese medicine prepared by Professor Chen Hailin, all symptoms disappeared. To clear. There's been no recurrence for 22 years so far, and once healed, he has never taken drugs for life. He has truly achieved no recurrence and no metastasis. Patient, Wang Muzhen, female, 63 years old, from Linqing County, Hebei Province. The patient underwent surgery in a hospital in Shijiazhuang for cardiac cancer in 1994. After the operation, she remained in good condition. In early 2002, she had severe stomach pain and swelling, which was most obvious at night. In February 2002, the pathological examination was carried out at the Hebei Provincial People and Apos S Hospital, and suspicious cancer cells were seen in the pathological diagnosis, anastomosis. On February 21, 2002, I went to Professor Chen Hailin for consultation. He was thin, pale, swollen lower limbs, and felt a lymph node mass in the right collarbone and right armpit the size of an apricot nucleus. Professor Chen Hailin prescribed a series of herbal decoctions after hearing and inquiring. After 5 months of treatment with traditional Chinese medicine decoctions, all the above-mentioned symptoms disappeared. In 2018, Professor Chen Hailin personally returned to visit the patient. The old man is in good health and has no recurrence or metastasis for 20 years. Intestinal cancer patient, Li Xiu and Apos, female, 68 years old, was an employee of Chengzhou Hydraulic Factory. Come to see a doctor before October 6, 2011. Due to my belly fat, the ambassador has been dry for more than half a year. On May 5, 2011, he underwent an electronic clothing inspection at the People and Apos S Hospital of Chengzhou City, Shaanxi Province. The clinical diagnosis, colon cancer, and the pathological diagnosis, tubular adenocarcinoma of the descending colon mucosa. On May 10, 2011, he underwent surgery for tubular abdominal pain in descending colonic mucosa in Heihu Hospital affiliated to Chengzhou Medical College, and was discharged on May 24, 2011. During this period, his physical condition was basically normal. The first chemotherapy, which can be given a month after surgery, starts in seconds. Sudden shock, after timely rescue, finally turned the corner and appeared 10 days later, with emaciation and weakness, abdominal pain and abdominal distension, vomiting after eating, and stool soup or nuts. Pale tongue with thin white fur, slow and slippery pulse, with a history of chronic gastric symptoms. After more than 8 months of careful treatment with many pairs of traditional Chinese medicines, the patient and Apos S body weight increased. He has recovered more than 110 kgs, and the stool indexes are close to those of ordinary people. The above-mentioned diseases have been effectively controlled and cured. During the Spring Festival in 2022, Professor Chen Hailin personally returned to visit the patient. Grateful. After the patient was cured at one time, no recurrence and metastasis were seen, and the health status was good, and it has been 11 years so far. Wang Chunping, female, 59 years old, from Jiaozhuang Township, Lincheng County, Xintai City, Hebei Province, went to see Professor Chen Hailin on March 10, 2020. Chief complaint: recently lower abdomen drop, waist and back pain, decreased appetite, recently aggravated. On March 10, 2020, I went to Professor Chen Hailin for treatment under the guidance of my friend. First sighting: emaciated body, bitter complexion, depressed mood, pressing the right lower abdomen tightly with both hands, difficulty breathing, decreased appetite, nausea and vomiting, general weakness. Dialectical, dampness heat pressure, phlegm poison mutual knot, Qi and blood 2 deficiency. Treatment, clearing heat and detoxifying, dispelling dampness and dispersing silt, invigorating Qi and nourishing blood. Please observe the pathogenesis and follow the above. After more than 2 months of careful treatment and patient care of more than 20 TCM medicines, the patient and APO's mood was basically stable, the pain of the lesion in the right lower abdomen was relieved, and the patient felt better. On June 10, 2020, the CT medical image diagnosis report was submitted in Xintai People and APO's Hospital. Examination site, chest plus abdominal enhancement. Inspection shows bilateral thorax symmetrical, mediastinum centered. Trachea, bronchus unobstructed, no stenosis. The liver is normal in shape and size. On October 2, 2020, in Lincheng County Hospital of Traditional Chinese Medicine, CT examination report, examination site, lung plus whole abdomen plus pelvic cavity. The results showed that there was no obvious abnormality in both lungs, no abnormality in both kidneys and no abnormality in uterus. Complete clinical cure. After spending nearly a month visiting deceased patients and their families receiving Western medicine, Wang decided to choose traditional Chinese medicine. Wang Chunping was cured by traditional Chinese medicine for 2 years and was cured once without recurrence or metastasis. Follow-up in mid-May 2022, in good health, always engaged in housework and agricultural work. Jia Yongle, female, 69 years old, is from Beijing. The patient suffered from multiple gliomas. The intracranial area was located on December 14, 2018. He was admitted to the Army General Hospital for a week of related examinations. On the morning of December 21, 2018, 2 larger brain tumors, resection, brain tumor surgery on the morning of December 21, 2018, and was discharged 2 weeks after the operation. Transferred to Yanda Hospital on January 7, 2019, the second last 10 radiotherapy sessions in March 2019. After a total of 30 sessions, the patient was completely paralyzed, became a vegetable, lost all functions, swallowing, speech, blindness in both eyes, loss of consciousness, stiff limbs, urination and defecation are manually helped and felt, and I have been unable to wake up, and finally failed. At the critical moment, the insider asked for help from Professor Chen Hailin. Professor Chen Hailin arrived in Beijing by plane at 8:10 a.m. on May 31, 2019, and went straight to the neurosurgery department of Yanda Hospital. Seeing the patient, Jia Yongle carefully observed the patient and APO's complexion, demeanor, breathing, blood pressure, blood nourishment, and heart rate. The family members were very worried when they saw that the patient hadn't, and APO's turned his eyes straight for more than 70 days, and urgently needed to let the patient open his eyes to see everything in Juju. At about 8 p.m., Professor Chen Hailin began to treat patients with Chinese herbal decoction. At this time, the family members were afraid that there would be troubles, and they began to worry. Professor Chen Hailin also expressed that he was really embarrassed and encouraged his family members many times. After 1 or 2 hours, everything was normal. He continued to observe, check his body temperature, blood pressure, heart, epilepsy, and prevent accidents. Finally, 10 hours passed, and an amazing news when it came. Jia Yongle finally opened his eyes, and his family members and surrounding hospital staff all saw it. Under the condition that the director of the Department of Neurology of Beijing Hospital and the director who returned from studying abroad were helpless, the patient opened his eyes under the treatment of Chinese herbal medicine. Since then, the patient has to open his eyes to look around every day. Due to the extremely severe damage to the ventricle, recovery is almost zero. In order not to affect the interests of the hospital and APO's departments and the cumulative effect, they still act according to the requirements of others. Entering January 2020, the new crown pneumonia began nationwide, and the hospital banned outsiders from entering the hospital. Professor Chen Hailin was unable to enter the hospital, so he interrupted the treatment of the patient. He had no choice but to give up, but the patient and APO's eyes were wide open every day, and he lived consciously. Down. Due to the lack of treatment for a long time, the patient bid farewell to his relatives in late October 2020 and left this world peacefully after inspecting everything around him. I didn't and APO's open my eyes for 73 days, and there is no precedent for recovering the nervous system in Western medicine, but Chinese medicine has done it. This is another pioneering work in the history of brain nerves. It has also established evidence that Chinese medicine can treat the brain nervous system. Yu Gei, female, 63 years old, lived in Diancheng Town, Luqing District, Chengji City, Shaanxi Province. The patient started esophageal cancer surgery in February 2001. She had difficulty swallowing and could only eat liquid food, rice soup, noodle soup, vegetable soup. She had epigastric pain and indigestion. She took baking soda and white-supping every day. Yeast flakes for support. Even worse at night. In mid-June 2001, I underwent esophageal tube expansion twice at Chengji Heji Hospital. The hospital requested a stent, but my family members disagreed and asked for traditional Chinese medicine treatment. On September 6, 2001, he came to see a doctor for treatment. To regulate qi and remove blood stases, reduce swelling and relieve pain. Relieve acid to help digestion. Focus on the treatment of lesions, expand the power of triple burner gasification, and transfer pathological cells as the key breakthrough. After more than 4 months of clinical treatment, I feel good about myself. After inspection, 21 years have passed so far, and the life of the elderly, the physical side. In the difficult years, Chen Hailin experienced too much. In a summary, 90-9 sweat, a point inspiration, more than 40 years of realization. Professor Chen Hailin has developed thinking and imagination of thinking and imagination from multi-layer, multi-system, multi-directional, multi-dimensional roads and multi-channel thinking. Based on the combination of traditional culture and transformation books and the combination of 5 elements and Qigong, yang and yang, and nourishing disciplines. Under the guidance of traditional Chinese medicine, the three-focus gas theory is organically combined with the diagnosis of modern medicine and image data. Perform symptoms of drugs, perform gasification intervention in the internal and gaseous centers, spleen and stomach, for gas exchange mechanism to enter and exit the lesion, quickly curb the diffusion and metastasis of cancer cells, and directly destroy mutations of mutant cancer mutations. Cancer cell repair lacks mutations, and cells and cytoplasm cells make cancer cells reverse to normal physiological cells. Theoretical foundation, Tianyuanji Da, describes, it is the gas in heaven, the ground is shape, and the shape of evaporation will be made from all things. The principles, pathological phenomena, disease diagnosis, treatment and prevention principles, so as to quickly achieve the purpose of cure tumors through gasification evolution. A comprehensive cancer treatment plan has been formulated with unique Chinese medicine characteristics and innovative thinking.